Back here at home, a new study is highlighting the hospital staffing crisis across the province and warning that things could get worse as morale among workers plummets. And joining me live now is the study's co-author, researcher Jim Brophy, to help break down the results and discuss what is needed to see change right across the province of Ontario. Good morning, Jim. Thanks for joining us.
Thank you for having me.
We'll start off with some of the highlights. What you got from this study in terms of what workers are feeling when it comes to morale and how this differs from a study that was done in the fall.
Well, this is the fourth study that we've done in the last 7 years of Ontario healthcare workers. We started off in 2017 exploring the issue of violence in healthcare. And that was a very disturbing set of interviews we did because I've been involved in occupational health for over 40 years and was completely unaware of how serious this problem was. The almost daily attack, physical and verbal assaults on healthcare workers. And it was revealing in terms of what their working conditions were like. How is this possible that in a healthcare setting that it became known as one of the most potentially violent places to work, one of the most violent workplaces. And then we took a look at what the next study was looking at the pandemic and the impact that it had. And there a lot of mental health issues were being raised, the extreme anxiety and stress and burnout that people were facing. And so after the NANOS findings, where there was such high level of stress, 75% of the workers were feeling stress, over 50% didn't want to go to work, dreaded going to work. That actually launched this study. And so we interviewed workers, healthcare workers, many nurses and PSWs and so forth across the province. And what they told us was very disturbing about their morale, the moral distress that they felt, that their code of conduct and what they've been trained to do, they felt they weren't doing it. They weren't able to do it because they were so understaffed and so under-resourced. And the anxiety that they felt about it. Many of them wanted to quit. Many of them, they were saying, I'd be better off going to work at Costco. So these are nurses, with 15, 20 years experience working, palliative care where, we really count on their support. And they say, I can't do my job. I cannot do it. I remember one nurse saying that she gets off the elevator and starts crying because she dreads what she's going to face that day. And so, yeah, it was a very disturbing, because we all count on our healthcare system. It's something that's one of our most precious social programs.
Right, it's very eye-opening because this is different in the sense, it's not just a survey where staffers were ticking boxes. This is about, talking to nurses and staff, PSWs, and getting that lived experience like you had mentioned. And a lot of these people who are suffering from this, they're women, they're racialized women as well, for the most part, when you look at it.
Well, I mean, this is definitely a women-dominated workforce. 85% of healthcare workers are women. Many are racialized or immigrant, and they're facing the brunt of this abuse. I mean, when we were doing the focus groups on violence, and violence was an issue in this mental health thing, the healthcare workers reported that it's increased since the pandemic, if it's imaginable that it has increased. They talked about how devastating this was. And I think it was revealing because we have special legislation that's supposed to protect healthcare workers from violence. And it's clearly not there. So this was one of the things we tried to look behind the curtain. Why are these conditions being allowed to happen, especially in an institution that we consider our most precious social program? And the underfunding, the consistent underfunding, the understaffing, the deregulation, not using the law to protect people and ensure their legal rights, and the privatization that's going on. This was all brought out by these interviews. The workers themselves viewed this as the source of the problem. So unless we begin to address these underlying causes, it's frightening what lays in store for us.
And we're out of time, but I just quickly want to ask, What happens next then with this information? Is this going to be going to the province? We know that there is a press conference later this morning at 10 o'clock at Queen's Park.
Yes.
But what are you hoping to do with this information?
I'm hoping that the stories and the experience of the healthcare workers will enliven and enlighten the public. You don't have to watch the news, for instance, to know that our healthcare system is in crisis. Every day we hear about an ER closure or hallway medicine or, months waiting for a test. We know this is going on, and the healthcare workers are sending out a very strong message to everyone that this is eroding our system, and it's affecting them, and it's affecting the care they give. So I hope that this study will enliven the public, and they will demand that the funding and the staffing and these issues be seriously addressed.
All right, Jim Brophy joining us, co-author of this study. Thank you so much for joining us.
Thank you for having me. I appreciate it.
No problem. 7:38 here on BT. Time now for a look at the forecast. We're going to send things over to Frank Ferragini now.